everyone. At this stage, I'd like to welcome you to the Master of Public Health in Nutrition and Dietetics webinar. This is Pierrette Buklis speaking, the Program Director for our Dietetic Training and MPH program. And I am assisted by Jarizal Bulanati, who's our Program Admin, but also a recent grad of our program. She's helping me with the tech and with any questions, moderating those, because this is our first ever webinar. So I'm glad that we're doing this, but I'm also hoping to manage expectations that if we make a few mistakes, we will learn from them. We are in an office that has some street noise in the background because our campus is downtown Toronto and we're right near the hospital row. You may hear the occasional siren or other type of noise. I apologize for that in advance. And we are going to be moving along today with a presentation followed by questions, but please type in your questions at any time and we will answer them in order at the end. Also, if there's something that you need to share with Jarizal, like you can't hear me, please definitely let her know that through the chat side. So let's talk about today's agenda. We're going to be giving you an overview of the program. We're going to be talking about our partners. We will discuss advanced standing. I know that was of interest to some of you. We will review the application process and get you started on some next steps if you haven't already. And at the end, as I mentioned, we will have questions. So our overview. We have a program that is in the home of the University of Toronto at the Dalla School of Public Health. We have close ties as well with the University of Toronto Department of Nutritional Sciences, but we are actually housed in public health. That only is for an administrative point of view. We prepare dietitians who focus on all areas of practice. We have partners who are very involved with the development of our program, the University Health Network and Toronto Public Health. They have been with us since our program evolved into a full-on dietetic internship along with the MPH. And they are part of the curriculum development team, part of our instructor team, and offer a certain number of placements each year to our students. Those who are interested in joining our program, the prerequisite is that you have a 4-year undergraduate degree in food and nutrition from a program that is accredited by PDEP, the Partnership for Dietetic Education and Practice, which is the Canadian body that certifies which programs have met the standards that are necessary. There are equivalents to these PDEP accredited programs. If you are studying in the United States, any program that is accredited by ACEND, A-C-E-N-D, is also considered equivalent. And there are programs in Australia that also have this status. If you are outside of any of those programs, you have not come to a Canadian program that has been accredited by PDEP, or you are not part of an ACEND or Australian accredited program, it would be important for you to follow up with the College of Dietitians of Ontario to understand if your program has prepared you in an equivalent fashion. Unfortunately, we cannot make that assessment ourselves, and the College of Dietitians of Ontario is prepared to do a standard assessment of undergraduate credentials. Once you have finished our program, you will have earned an MPH, Master in Public Health, and also completed a program of dietetic practical training, aka an internship. It's really important to understand that we don't have separate MPH and internship elements that are simply housed in the same 2-year program. Our program is integrated, so there are assignments that you would do during your courses for the MPH that would count towards the practical competence achievement that you will be completing over the course of the time you're with us. And our focus is to develop expertise in dietetic practice across all areas of practice. We are also part of a group in the Dalla School of Public Health that is the Clinical Public Health Division. And that is a big piece of our program philosophy. Because of that, I think it's something that I should touch on a little bit more. And it's certainly something, here's a hint, that we would expect you to see address in your letter of intent if you're applying to us. From our point of view, There is no separate clinical care, public health, or preventive medicine. There's a continuum of care that exists for well people who interact with the system occasionally to maintain that well status, to people who are in need of some level of treatment, to people who are trying to live the healthiest life that they can out in the community with chronic health conditions, to end-of-life issues. And this can take place at any age or stage along the continuum of life. So we think that it is very important for our students to be considerate of the implications of their practice when they're in a clinical setting. How does the outside world affect their client's ability to be able to take the advice and implement the treatment programs that they've suggested? And we also believe that when you're out in the community, the things that you're encouraging people to do to avoid entering treatment or to prolong their life without treatment need to be considered from the point of view of the various pieces that might have to be addressed, say to address an underlying concern that's coexistent with something else they're worried about. These things are a little bit messier than they appear when you think about the training streams that we've traditionally had as dietitians. And for that, we try to work through our program to have everybody consider the implications to one side and then the other, from determinants of health all the way to tertiary level care. The program itself does take up 2 full academic years, and generally a good part of the summer in between. It's about 20 months in total. In your first term, you'll be introduced to courses that are required to establish your program, but also to give you the foundations you need to move out into your practical work in the second term. In the fourth term, which is the fall of your second year, you'll begin a little bit more flexibility around your course requirements. There's only a couple of required elements, and then you'll have more elective space. One of the great things that we've been able to do in the past couple of years is to open up the possibility that you could engage with the university through some of the other program opportunities here, including collaborative specializations, or in the future, potentially emphases that you would like to customize your program with, so that at the end, you've met professional goals that are going to take you in a direction that will suit your career. And in the fifth term, so the winter term of your second year, it's a bit of a culminating term where there's one required course outstanding for the MPH, but then there is a culminating course that will be very practical in nature, and that one is still under development, but we promise that it would flow well into the work that you've already done from your first year and a half. The curriculum here is rigorous. It would be a mistake to think that you're not coming to the University of Toronto for a full-on master's degree. And so the expectations of the professors are high. The level of the qualifications of the students you'll be learning with are high, and you'll end up coming out much stronger academically than you were when you came in. The researchers and the professors that you'll be dealing with have probably educated some of the biggest minds in policy development or nutrition care or business over the course of their careers. And so we are very proud of the academic opportunities you have here. There's also a significant practical learning component. For our program, for the full internship program, you need to have at least 24 weeks of placement. And that accounts for an opportunity to explore all the areas of practice in a very hands-on way from a dietetic point of view. And through all of this, you're going to be prepared for taking on jobs that would be in any area of practice for dietetics. Speaking of that, our grads, some of whom are pictured here, work in a variety of settings. Some of us are back here at the university. Some people are working in hospitals and tertiary care centers right here along University Avenue in Toronto. We have had graduates who are high-ranking government officials and who have taken food service management to new levels in a really strategic way. We have colleagues that work in the food industry, helping to if you will, keep a conscience among the business people. And we have colleagues who are out there specializing in media and communication, being on television, being social media experts, and providing information to the public in the ways that they're most likely to be able to receive it. Again, I'll mention our partners, UHN and Toronto Public Health. There's a couple of things that I need to highlight about these partners. One is that not all students are placed with these partners for practical training. Our partners are involved with us in many ways, and you'll likely have a chance to interact with members of their staff in a variety of sessions. But there are only a limited number of placements available, for example, at UHN. Approximately 10 students per year go there for a more in-depth nutrition care experience. What we are working on right now is making the process of selection for who goes to UHN a little bit more formal, in the sense that we are trying to introduce for next year, in time for any of you who are applying to come to us, an emphasis in nutrition care, which would indicate that you will go to UHN so that you know right from the beginning where you stand. But regardless of whether you go to UHN or any other of our placement sites, you can have a full nutrition care experience and get in-depth training. Currently, Toronto Public Health is in a period of change, and so our placement opportunities there have been more limited. We hope that they will be able to come back online with us next year for placements, but their staff has still been very involved in assisting us in delivering guest lectures, workshops, and being a part of the development of the curriculum you need to be ready for public health. I'd like to spend a moment talking about advanced standing. Advanced standing is a very particular opportunity that we have at the University of Toronto in our program. This is for dietitians who have been in practice for 5 or more years as a dietitian after graduation, and they are interested in enhancing their credentials in order to make themselves positioned for more leadership opportunities, or maybe taking their career in a slightly new direction. Because of their experience, advanced standing candidates are not getting an internship here, and this is not a mechanism to be recognized in Canada as a dietitian. However, we do have international applicants who come to this program because they'd like to take this certification and these credentials back home to work. It is a shortened program, recognizing the experience that you bring. And so it is only 1 year long, with half of the total credits that are required for a placement for our regular program. And only 4 weeks of placement are required. That doesn't mean people can't take more as elective, but those are the required weeks. We also do not require that you take your placement as an advanced standing student in your home organization. You may, if that's suitable to your goals and to your employer. It's possible for you to do that and to do a depth project back where you work. On the other hand, we can also help you find new opportunities to stretch yourself and gain experience that would be important for your career development. Let's look now at the application process. Again, your undergraduate degree, no matter which part of our program you're applying to, the regular program or advanced standing, needs to be a proper dietetic degree. And if you're looking at the undergraduate program, the regular internship stream program, it must be from a PDEP accredited undergraduate program in nutrition and dietetics within the last 3 years or the equivalent. You need to send us transcripts. For the purpose of the application, they can be unofficial and simply PDF scanned according to the application site requirements. But you will need to send a formal official transcript if you are accepted into the program. You need to write a letter of intent that is 500 words and addresses the 3 questions that are outlined on the website for applications. You need to submit a CV that shows us your relevant work, volunteer activities, awards, and so on. And you need to have 2 references who can speak to your ability to succeed in a graduate level program and as a dietitian. These do not need to be academic references. If you know a professor who's willing to write this letter for you, that would be fabulous, but we are very interested in what these folks can say about your experience and your readiness to take on this program. One of the things that I often get asked is whether the marks are the limiting factor for somebody getting into the program. And I'll be very honest, the Graduate Studies Department here needs to have a mid-B average in order for you to be considered acceptable to the University of Toronto. That mid-B needs to be in your final year worth of coursework. But beyond that, we are looking very seriously at your letter of intent and your curriculum vitae and your references, because we do like to see well-rounded candidates in the program. So sometimes it's not the person with the highest marks that gets the offer of admission. It's a well-rounded candidate whose marks were at the level that's acceptable to the university. So we are reviewing advanced standing applications a little bit early this year. We're trying to make sure that those who are in the middle of their career already and maybe considering a return to school have the time that's necessary to make the decisions and logistical changes that they have to in order to join us. The application date is going to be December 20th. All of the application elements must be in. We will review applications in early January. My beginning of year is a little skewed right now. And we will begin to communicate with the successful advanced standing applicants at the beginning of February. For our regular program, the due date for applications is in mid-January, January the 17th. We already have our in-person interviews scheduled February 27th, 28th, and March 2nd. So if you are through the first level of application screening, you'll be hearing from us in order to schedule a date for you to come for one of our in-person interviews on one of those dates. And after that interview has happened, the team will meet and decisions will be made and communicated beginning in the week of March 6th. The place to start really is our website. Our website has a link into the application process and provides you backup of all of the information I've presented today, as well as addressing quite a list of frequently asked questions that has been enhanced even after our open house back in October. I would advise anybody who's interested in applying to us to head there and comb through that website. Okay, thank you very much. And I know Jericel's been busy working through the questions that have been coming in, so I'm going to begin to answer those now. Okay, so the top question here is, what are the placement options for those who don't get into UHN placement or Toronto Public Health placements? We have partnerships with hospitals all over Toronto and outside of Toronto. We have Humber River Hospital, we have placed students at Michael Garron Hospital, we have involvement with Trillium Health Center in Mississauga, just to be very close by in the GTA, but we've also had students who've done clinical type of placements in Kingston, in Nova Scotia, in British Columbia, because our networks are quite extensive, and so you are not limited to just our partners. We've got lots of connections, lots of graduates who are very happy to take our students and continue their training. From a population and public health point of view, again, our roots are very, very deep in that community, and so we have students who've been doing placements at Diabetes Canada, Dietitians of Canada. We have students who've been on First Nations reserves doing population public health placements, in correctional facilities who have taken on food bank-based placements in different cities across Canada, opportunities to work with social programs that provide community hubs for food access and training of students in food skills. There's a great deal of opportunity for placements in the population public health sector, and Toronto Public Health is one of many for us. Is there a high level of collaboration between dietetic MPH students and the various other MPH students? I would say it is moderate collaboration, we try to encourage it as much as possible, and all of the programs, the MPH program courses are taken together. So that includes Introduction to Public Health Sciences, Public Health Policy, your Introduction to Quantitative and Qualitative Methods. These courses will put you in connection with these students across all of the programs. Your electives will determine to a great extent how much more interaction you have with your colleagues in the MPH programs. Sometimes our students are interested in collaborating more with the nutrition science side of the program, and sometimes our students are very excited about the health promotion opportunities, about the occupational health opportunities, the health communications, and others that would bring them back in contact with the MPH students across all the programs. So there's lots of opportunity. It's up to you to decide how much you want to engage. A question again about UHN placements. I think I've mentioned some of the places that you can go for nutrition care experience. How do we determine who gets UHN placements? I'll be honest, up till now it's been about what your expressed interest was in the course of the applications and interviews relative to your experience. But we'd like to make this more clear, and so we are developing what's called an emphasis so that students will actually apply after they are offered a place in our program. If you are very interested in a UHN placement, there will be an emphasis in nutrition care that will clearly identify who can be a part of that program. And you'll apply to it in the spring and be informed by the summer if you've been accepted into it. And so there will be an application process that will be announced as that program is finalized. We'll be sharing that coming up in the spring. The interview. How can we prepare? Honestly, I think you should come with your best self. There are situational questions that you will be asked across all areas of dietetic practice, and you will also be asked about your interests in the field and what has brought you to apply to our program in particular. It's like any job interview. Know your audience. You're applying to the University of Toronto Nutrition and Dietetics program. Understand what the university is about. Understand what our philosophy is about. And make sure that you are remembering your coursework, because there will be questions that relate to food service and nutrition care and population health for you to be able to answer to our team. A guaranteed stipend for unpaid placements is mentioned in the FAQ section. That is a fairly new thing that we've been able to negotiate with, thanks to a series of grants that has been made by funders to the university. Now, for sure, for our students in their first placement, there will be a guaranteed $3,000 stipend that comes to them if you are not paid. And most of our students are not paid for the placements that we offer. So you can count on that. We are always looking for new ways to help our students meet their financial needs, and this is one of them. We also have a couple of scholarships for entrance and a couple of scholarships that would be awarded to second-year students, so there's some more support there, usually in the $1,500 to $2,000 range. And there are always bursaries and other types of awards that are being students are being notified about. We try to make sure that if we think they apply to you, we highlight them to our students so that there's an opportunity for you to apply for that assistance. We recognize that it's a financial challenge, especially as changes have happened to OSAP this year, and we're doing everything we can to try and support our students in taking the program on. A question about advanced standing. Does planning for the practicum start at the beginning of the program in collaboration with the program director, or is this done in second semester once coursework is complete? Thank you for that question. Advanced standing is a little bit different, and you are more involved with planning your program out with the program director from even before you actually begin the program. It's very helpful for me to know what your interests are in terms of placement so that we can start to consider together some of the options that might work for you. This year has been quite a different year as we've moved to our new schedule for our regular stream students, and our student cohort has increased for the internship group. But it would be ideal if you were already, by say Thanksgiving or so, thinking about the kind of placement you'd like to have in the summer, and we could begin to weave that through some of the coursework that you're already doing. So that is a difference for the advanced standing program. We don't have to lock things up quite as quickly because you're not in placement in January, but it's a good idea for you to already have a direction as early in the term as possible. Okay, a question. I know of a dietitian who graduated from this program that did her industry practicum part in England because she had connections there. Are these kinds of options still available, and how do they work? We've had international placements across all areas of placement because of a student's interest and because of an opportunity that presented itself. We are always happy to work with that. If you are interested in taking on an industry placement that's outside of Canada, we have connections, we have people who've worked in that field before, and we can help you sort that through. One thing I'll take advantage of to discuss at this point is that we don't encourage our students to necessarily go out and solicit placements for themselves, especially if you're looking in the Ontario or Canadian field, because we have so much engagement with the other schools that are also training dietitians that we want to make sure that everybody is fairly treated and that we are being respectful of all of the interns looking for placements. Usually this means that Mary, our practicum coordinator, will reach out on your behalf if she knows that there's already not 3 students going there from Ryerson and 2 from Brescia, for example. And then the other thing is the university has requirements about the paperwork that's required before we can send a student into placement. And again, that's something that Mary has a great deal of experience with now and can let you know how easy or difficult it might be to obtain that with a connection, be it in Canada or outside of Canada. But there are lots and lots of options, and we do try and tailor your placements to your interests and your program needs. I love this question. Is this a terminal master's, or can we pursue further studies if need be, like a PhD? I really hate the expression terminal master's because I don't think that anything in education is ever terminal. However, this program does not automatically allow you to upgrade into a PhD at this time. There is some work underway to create a doctorate in public health through the school, and we may be one of the programs that could feed into that in the future, but for right now, that's not the case. However, each year we have at least 1 or 2 students who expresses interest in a PhD and is accepted into a PhD research program because they've applied to it and met with a supervisor who's very interested in having them work with them. It has not been an impediment in any way, and most of our students are completing PhDs in, not going to say the minimum amount of time, but they're not extended, even though they may have to make up a few courses. The next question looks at the balance of 6 courses in the first term. And that's a very good question. We've debated that one a lot, and feedback from our students in the past couple of years has been that it's not such a burden. Much of the work that's done in Introduction to Public Health Sciences is actually completed in the very first week that you arrive on campus, in the orientation week, if you will, and therefore it's out of the way before you truly get into the first week of classes when the other 5 courses kick in. So for that reason, our students have given us feedback that the 6 courses is generally manageable, I'm not going to say it's easy, in that first term, and has been very helpful in setting the groundwork they need for moving into placement. The next question is the MMI an in-person interview, or can it be done on the phone as well if you're out of province? In general, we like to see everybody together for the MMI in person if it's at all possible. However, we understand that it's not always possible, and so we have made exceptions to allow students who are out of province to be able to do a phone interview with us. It's a slightly different structure, but we were able to manage both in the past. So that is an option. Still, if there's a way, we'd love to see you in person. It gives us a different perspective on you. Do students of this master's program live in downtown Toronto? Yes and no. Many of our students do live in downtown Toronto. It certainly makes life easier trying to get into classes and be on campus for study activities. However, we also have students who've managed the commute from some distances, and we want to make sure that you don't feel you have to pay downtown Toronto rent in order to be able to manage this program. The next question goes back to our interview process, and it says, does the interview process involve clinical type questions, i.e. applying clinical knowledge? As a matter of fact, yes. I'm usually not the one who's in charge of asking those questions because my background is not so heavy in clinical, but our UHN partners are involved and usually have a great case that they would like to put in front of all of the students to see how comfortable you are with the clinical interview process or the clinical types of assessment questions that you would ask. Is our program OSAP eligible? Very much so. It's a definite University of Toronto master's program, and just as all graduate programs, it is eligible for you to apply to OSAP. With that said, I think it's unfortunate that this year OSAP has been more restrictive than in the past, and so many of our students have found it more difficult to get the kind of OSAP support that they've received. But most of them are still applying, and most of them are still getting something. For now, I'm glad to hear that. I hope it will get easier again. What are some examples of work students do after completing this program, other than working in hospitals or for the government? In some ways, I think it might be easiest if I give you some of my own personal experience on this one. I left the program and decided that I was not interested in clinical work in a hospital. As fascinating as it is and as high value as I can see it being, I moved into public health, and I worked for a local public health department for 5 years as a public health nutritionist, creating school food policy, handling community events to raise awareness of nutrition issues, training our public health nurses and our public health inspectors on nutrition-related issues that they might carry into inspections at restaurants or schools, or work that they did in the community with seniors or new moms or teenagers. I was able to give commentary back to the government through that process about issues of policy change that were coming up, that were being considered. It was a really exciting period of my career at that stage. And not too long after that, because of some experience I'd had as a volunteer with Dietitians of Canada in media for Nutrition Month, I found myself working for the Canadian Sugar Institute, which is a private enterprise but a nonprofit group that works with media to provide information about sugar, obviously, works with government to bring the science to bear on policy discussions, and with health professionals to share that information as well. Following on that, I opened up my own private consulting business that did various things. I was interim management for a while for the Canadian Foundation for Dietetic Research. I provided web copy and written work for media for groups like the Tea Council or the California Walnut Commission. I was involved with a research project where I was coordinating the validation study of the NutriStep toddler nutrition screening tool for cross-Canada use. I was involved with General Mills as a consultant, as an advisor, and through that I ended up moving on into working with General Mills for 10 years. So as you can see, then I was able to become part of the food industry to help them craft their messages, but also craft their products in a way that was more responsible, was more informed about the nutrition impact of those foods. And from there, I've moved now here to the University of Toronto to get more involved again in education. I've spent many years as a preceptor, and I've always been very interested in the development of our profession. And here I am back at the University of Toronto in this capacity. I only use my example to show you that your career after this program can take you in many, many different directions, and probably will, because the stats are that most of us change jobs at least 3 times, and that may be more by the time that your career is in full swing. So I want you to not worry that you're limiting yourself to one area. We have several graduates who've moved on into significant clinical positions, if that is what you want. We have a very big interest from a potential partner to start employing more dietitians in a strategic way in food service management and in addressing food service issues. There are lots and lots of opportunities for us. And some of our most recent students have been placed in really exciting international opportunities to do groundwork for introducing or reintroducing indigenous foods into the family kitchens in Kenya, and looking at evaluating World Health Organization programs for breastfeeding initiatives. The world is your oyster. And this program offers you a set of building blocks that you can use in whatever way suits you. The next question is there a creative component to the application, projects you've worked on, presentation, etc., to demonstrate our communication skills? Not officially. We're not asking you to submit an item of that kind of work, but we would love it if that's something that's been important for you to talk about it in your letter of intent. The letter of intent is really a way for us to get to know you a little bit better, and for you to explain how the kinds of work that you're doing is something that you feel can grow through the process that we use here to educate you and prepare you as a dietitian. So we would love to hear more about it. We would love to see it profiled in your CV. I'm hoping that you'll share that with us. Communication skills are quite important. When we refer to clinical, are we referring to hospital experience or working with clients in general? Both, you're right. Clinical experience can be applied in a hospital for sure, and we have a tertiary care partner who applies it at the highest levels that one can imagine. But we also, when we use clinical, we describe as well those who are meeting clients in diabetes centers or community health centers, family health teams, in long-term care where you're working with the residents for nutrition care issues, small community hospitals potentially, working as a consultant one-on-one, as a fee-for-service dietitian. All of these things fall under the realm of clinical or nutrition care. Can this program be done part-time? Yes, it can. It's more spread out, and we need to be mindful of prerequisite courses. So we haven't had too many students who've decided to do it that way, but if you are interested, that is certainly an option. The university recognizes that you can do the part-time master's in up to, I think it's 6 years, and spread your courses out in a manner that works with you around work or family obligations. So that is an option that we can discuss. How many qualified applicants do you expect? Our applications have been in the neighborhood of 130 to 150 each year since I've been here, and I've been here now for 4 cycles. So that's been pretty consistent. It may be changing. It's hard to say. Each year there are different factors at work. But we are accepting 30 into the regular program, and we would be accepting probably 4 to 5 into the advanced standing program this year. So advanced standing would be a different pool, but just so you have a sense of how many will get an offer from us, that's how many we'd like to see starting with us in September. I spoke about some things that I look for in the cover letter. What are other pieces of advice for writing a letter of intent? I'm going to go back to the fact that this is the opportunity for you to let us know who you are, why you think the University of Toronto program is a good fit with your interests and skills, and really give us a picture of what makes you a great candidate. This is a place to brag. humble brag? Yeah, no, brag. Because we need to know that you're really interested in our program, that there's something about our program, not just that it gets you to be a dietitian, that strikes you as a good fit with you. And the other thing is, we do ask that you proofread carefully, because there is nothing more off-putting in a cover letter than spelling or grammatical errors. Okay, how many students get invited for an interview? Again, I can speak from our recent experience. Each year can be a little bit different, but we've generally had approximately 60 to interview, and that's outside of our advanced standing group. So our list from the number of applicants gets cut down by a little less than half, by a little more than half, and then from there about half get an offer in the first round, and depending on what those acceptances look like, we do have a waiting list where we will go to students who were highly ranked but maybe not in the first 30. Are our courses pass or fail? Most of our courses are graded courses. It's a challenge because what we're trying to do is develop competency, and that feels like it could be more related to a pass-fail style of assessment. However, the university expects grading, and so all but our practicum courses at this stage are graded courses. Do offers from all schools go out on the same day? No. That's not the case. So you may find that you get an offer from one school whose interviews were a little bit earlier than ours before we even finish our assessment process. And the Dietitians of Canada match program that used to be a little bit more of a standardizing schedule for all of us is no longer in effect. So I noticed that this year, after talking to some of the other programs, that the interviews are a little more spread out from mid-February through to early March. And you may be in a position to have received one offer, hopefully it's your preferred school, before you've heard from all of the offers that might come your way. Can I explain how applicants are ranked? Applicants are ranked on the state, we have a rubric that we look for. We go through and have at least 2 of our assessment team screen each application to follow the rubric and look at all of the pieces of the application, assigning scores according to the rubric for each area, for letter of intent, for CV, for the transcript, and references. And then we meet as a group to review and ensure that we're comfortable that the scoring has been done appropriately, and identify our top candidates to be invited for interview. The top candidates are invited for the interviews. The questions are, again, standardized with a rubric for scoring. And at the end of that, again, the program group meets to try and assess what the scores look like, and if everybody's comfortable that everything was applied evenly. And once we're comfortable about that, the applicants who are coming from the interview process are rank ordered in terms of who gets the first group of offers and who would be the first to turn to based on newly available places. I don't want to get too deeply into the rubric. I think the honest truth is, if you are looking at the application site, you're going to see the elements that we look for in the rubric. You need to look for the grades in your final year in your senior courses. We are very interested in especially the senior nutrition courses and things like biochemistry and statistics. The reason we look specifically at those other 2 is because we find that they can be predictive of some of your success in the academic environment here. We will be looking to see if your CV offers varied experiences that have shown your growth as a person and a professional. We are looking at your letter of intent, again, to see that you understand our program and that you have really understood how this program in particular is going to help you to become the type of dietitian you want to be. And then we also look to the references to make sure that they appear to know you well enough to be able to give us confidence that what we're reading about in the material you've submitted is going to materialize into a candidate who's going to have good success. Is the interview process the same for applicants in the advanced standing program? No, there's a slightly different interview, and generally we found that the advanced standing, we're not doing a multiple mini interview format. We're going to be either interviewing in person or by phone/Skype. And the questions are more relevant to the experiences that you've had. Because you bring an entirely different perspective to your next stage of study than somebody who's coming to complete their professional credentials. So yes, you would be interviewed by more than one person. Yes, you would be interviewed on a series of questions, some of them related to scenarios, but we might ask you for a scenario when you had an experience in your career and how that went, what you learned. Okay, so the next question I have here is, what if you get an offer from another school before U of T sends out their offers? I wish I had a great answer for that. It has become even more of an issue now that DC Match is not in place. And last year, all of us at the various programs in Southern Ontario anyway, commented that there was a lot of movement in our acceptance lists after we sent out our offers. You have to do what's right. If you think that you are very interested in becoming a dietitian, if you get an offer before us and you want to take that offer to make sure that you can complete your dietetic training, obviously you're going to have to decide to accept it. If you hear from us next and you decide that it makes sense for you to accept our offer and reject the previous one, that may be what you have to do. We've certainly had students do that with us, where they received our offer and then spent some time considering it against other offers and have rejected ours. Every program is slightly different, and so there's lots of reasons why you might choose one over another, but you do have to be thoughtful about the fact that you are, in the end, aiming to get your dietetic qualifications and begin your career. I'm looking for, oh, here we go, a couple more coming in right now. How would this practica differ from other practica that do not specifically employ the systems approach? The placements themselves are probably not incredibly different from the placements that other schools would offer, other programs would offer. What happens next with them, I think, is where we are different. You need to have the experiences that will allow you to develop the competencies that are looked for among entry to practice dietitians, and that is the biggest thing that guides our placements. However, when you return in second year, you are generally asked to use those experiences from placement to build on your learning by reviewing and reflecting, by diving deeper into some of the issues that you identified, and suggesting ways that things could be improved versus what your experience was or versus what the situation is. So it really is that we take that experience that you've had in placement and then work it further in the course of your second year. I'm not sure that that helps a lot. You can probably get great placements in a lot of places. I just know that with a 2-year program like we offer, the depth that can result from the thinking that you're guided to do in the ongoing coursework can make a big difference to what you take away from those placements. Would U of T get notified when someone accepts another offer? No, we don't. That is between you and the other school. So it can be a challenge for us when we think we've got everything in place for our incoming class, and all of a sudden we hear that somebody's had another offer. And sometimes we've had the experience where that other offer comes from within our own academic institution. More than once we've had a student who applied to our program as well as the Department of Nutrition Science for a Pure Science Master's, and has decided to go, after accepting us, to the Pure Science Masters and join the Nutrition Sciences team. So we don't know about it until it happens, but we know that you have to weigh a lot of factors in your decision. We understand. Okay. We don't have any more questions coming in right now. We have about 10 minutes before we're officially closed, but I don't want to keep you all if you've thought through the things that are most interesting to you. So if there's anything else, maybe you want to share them. Okay, it looks like we might have one or two more coming in. Don't you wish we had hold music of some kind? I could sing, but you might not like that. Okay, our next question is the acceptance or rejection just a push button online, or is there something that you have to write in? We don't have a push button, so that's the first thing. The first stage of us making an offer to you is an email from us that says, we would like to have you join our program. Please confirm that you would like to accept this offer. And so you need to respond to that email with a, yes, I would like to accept this offer, or no, thank you, I've accepted another offer, or no, thank you, is a perfectly acceptable answer. It helps us to understand if there's a rationale, but if you answer us, yes, I would like to accept your offer, then you are placed on a list that goes to our graduate office, and they send out the official offer letters. When you get those offer letters, you have another response that's required of you in order to confirm your place in the class. That's the official offer, and then you have to send in your final transcripts, and you need to respond officially in the way that is outlined in their letter so that you can become part of our class. At that time, we often get a few that come back with a rejection by whatever means. It's not a push button, but it can be quite simple as a response. So you've got two chances to think about it. Both our email offer that establishes the list that goes to our graduate office, and then the official offer letter. A little bit of work more than push a button, though. Do I have any additional recommendations for preparing a CV beyond the suggested headings provided in the application instructions? Those don't even have to be your application headings. We just need to see those things. Those are some of the items that we'll be looking for. We've seen lots of different formats of CVs, and they're actually really interesting. Sometimes they tell us a lot about your creativity or your organizational thinking. And as long as they're complete, again, proofread, no spelling mistakes or errors, and easy for us to follow, we appreciate your time that you've taken to putting into it. Some people send in very comprehensive CVs. I don't know if that's entirely necessary, especially because it gets difficult for us to review everything. But if that's what you have and that's your best way of presenting your experience, then certainly we are open to receiving that. If you have something shorter, couple of pages with the most important details, that is absolutely fine too. It doesn't need to be a full academic CV. Is there a time frame regarding how long you have to accept? Yes, in our letter, in our email, we will indicate it's usually pretty quick turnaround. Are you going to accept our offer or not? Let us know within a couple of days. The date is provided in the email. And once we have your answer, and let's say you say yes, which we hope that you do, we would send it to the graduate office who writes you a letter that also includes a date, and I believe they give you 10 days to respond to the official offer. So each time there is a bit of a turnaround, there is a deadline. What we want you to know is that if we don't hear from you, we have a no answer situation, we'll usually try and reach back out and say, hello, we need to find out what your thoughts were. And we've also had students at the official offer stage, when they have 10 days to consider, contact us and ask for a bit more time because they're trying to work out some detail that they need to consider before they make their final decision. And we are happy to offer that extra time. Oh, okay. A question came up about a difference between a resume and a CV. A CV, a curriculum vitae, is supposed to be exhaustive. It is supposed to be a list of all of your experience and your credentials and your experiences professionally presenting and being a part of research teams. It's supposed to be quite a large document in the end. It grows over time, and some of our faculty have CVs that are in the realm of 30 pages. I would say that what we're probably looking for is a substantial resume. So we're more interested in the top line of what you've done and how you've progressed through your career so far. We don't need to see details of every placement you've had. For example, if you were working through high school, again, that might be a quick summary just to let us know. I've had people who have wanted to expand on the duties of a server at Jack Astor's, and for the most part, we know what the server duties are. But if you had something that was a job that we're not so familiar with, maybe it would be very helpful for you to explain it a little bit more. It's kind of a hybrid we're looking for. Resumes, I think in HR parlance these days, they would prefer to see them at a 2-page maximum and only the most relevant experience and work that would apply to the job or the position you're applying for. So something that short might not give us the detail that we'd like to see, but something as long as listing that you were a paper carrier or that you were a blood donor clinic volunteer in grade 8, we probably don't need to see, work that far back. And I think that, your on-campus student services probably has detail about the difference between resumes and CVs that would be really tactical and appropriate for you to look at if you're trying to navigate the difference between the two. For us, what we want is a resume that's perhaps a little bigger than the strictest definition of a resume to cover some of your, the color commentary, shall we say, about your life. Okay, we have a question about the candidates who've really stood out and what some of the qualities are. Everybody's got their own thing that makes them stand out. And this is why our team has to meet twice, both at the application review stage and at the interview stage, because it's quite interesting how different things strike different people. That's why we want to make sure that we've applied our rubrics carefully. But honestly, sometimes it's life experience that has stood out for someone, that they have all of the basic requirements, but they have just such an interesting set of life experiences that have led them to this place of wanting to become a dietitian, that their resume and references help them to rise up, even though, for instance, their marks might not be that stellar. On the other hand, we might have people who are unbelievable academic candidates, and we want to make sure that that we're considering those folks as well, and that may be the thing that stands out and really pulls their application out to the top. Some of our folks, maybe their application scores are just good, and they make it to an interview, but it's their presence in the interview and the way they tell a story and their engagement and the spirit that they show, the interest level in dietetics, that is the thing that pushes their ranking a little bit higher. So it is quite a different thing for each person, and I would say that you need to profile yourself as the candidate. You need to think about your strengths and show us how you meet the basic requirements but play to your strengths. I've had a question about the final year grades, and that being that if we make you an offer, will the final year grades make a difference? And yes, it's one more thing for you to worry about, I'm sure, but if you are doing well in your third year and in a transcript that shows what you've done in your first term, just keep doing what you're doing and you're going to be fine. But if you are concerned, the final transcript is the thing that the School of Graduate Studies will see and ask questions about. I have had one or two students in the past who their final transcript has been slightly lower than the mid-B average that the School of Graduate Studies requires. And I've had to go to bat in a case where our admissions team felt very strongly that student was a really appropriate choice for our program. And in most cases, that's a successful process. They really just want to make sure that we're bringing people in who are going to be successful in the master's program. One of the things that's quite different about graduate school from undergrad is that in large measure, undergrad is a process of eliminating people, and graduate school, once you get to this stage, is more a process of bringing our colleagues up together. Okay, we are at time. Thank you so much for all of your questions, and I hope that we see lots of applications from you. This will be recorded, so it will be up for review as soon as the technology allows us. Thank you.